everyone knows that where you go for surgery can make a difference. And we take pride in the fact that every single patient that we treat, even if it takes a little longer, we're gonna do it slow, methodically, we're gonna do the right job. Feel very confident in our ability to treat the patient to the best of our abilities and to the best that is currently available.
One of the things that makes the place very unique that doesn't get talked about a lot is just our relationship with the other services, not just our own, but with the trauma team and the general surgeons and the plastic surgeons and things like that. That uniqueness bridges over to the administration as well. The administration of the hospital are our partners. We have an incredibly good symbiotic relationship with them.
The patient experience is as good as it can be. And we've engineered it so those that provide the care while you're in the hospital, those with their hands on you the most, those intermediate care people are the same ones that follow you up in the clinic when it's a month later. Your eye contact, that voice, the person that delivered care, that communicated with your family is the same one that's following up the success of your treatment or dealing with any complications in the months to follow. It's not a pleasant experience entering our world. Something bad has happened. And from the beginning, you're surrounded by people that understand that.
I really think everybody is invested on taking care of the patient. And I feel our patients, from as they come in through the trauma bay until they follow up in our clinic, they really feel taken care of.
From the moment they arrive in the ER, I think they're met with a complement of world-class individuals, starting with the providers in the ER, and then from our team with the residents, the advanced care providers, and then ourselves. I think we are all trying to treat everyone like they're our family. I think we strive for perfection in all aspects, and we provide the patient with the best quality outcome that we can provide.
One thing that's unique about our teaching facility is that we do have PAs and nurse practitioners who provide continuity of care. They see the patient early on, preoperatively, postoperatively, and then also in the clinic. And this builds a relationship with the patient that just gives a quality of care that is unmatched.
The faculty that are here are outstanding and extremely dedicated to teaching and didactics, and I think that's a unique component of what we have here. And in combination with that, the volume and complexity of cases here to be able to apply those teaching moments. So I think the combination of those things really makes this the best fellowship program.
There's not really any part that we have that's not covered in depth with case examples, with volume, with experience in this place, because we enjoy working with each other, we get along, we all know and do what's best for the patient and what's best for the education, and so I think that really is reflected in the fellows' experience here.
It's the best orthopedic trauma fellowship for basically, it's simple. You have volume, you have excellent clinical cases, you have resource and support from the university, from the department head up and chairman down. You have a hospital that is supporting you as well. You have a group of individuals who all work as a team, who are all extremely knowledgeable, thoughtful, excellent innovative surgeons, and more importantly, superb educators.
The way we go about teaching the next generation, it has a lot of different facets to it, including lectures, on-the-job training, discussion of cases before the surgery, during and after the surgery, and then a debrief of the surgery afterwards to talk about what went well, what could have been done differently next time. So we have a track record of helping fellows get to exactly where they want to be at busy level 1 academic trauma centers.
The experience that I've had so far is a graduated autonomy, but it's also good to be able to watch and observe how some of the masters tackle some of the more difficult injuries.
Trauma is definitely a team sport, and you're only as good as your weakest link, and luckily from the top to the bottom of this group, there really are no weak links.
If you want to take care of high energy blunt trauma, there's no place better probably in the world. I look forward to waking up every single day to know I can take care of these patients in their biggest time of need.
I think that this fellowship prepares you so well to take care of whatever you're gonna see at a level 1 trauma center, because we see as much as you can for any trauma center in the nation. We like to say that we're the busiest because we are, but that allows you to see as many cases as you can.
Ours is the busiest center with the lowest mortality rate by far. And so they live. And they live as a result of the EMS response that's local, the Life Flight program, and then the teams that see them when they hit the door and keep them alive.
But it's very satisfying to look back and reflect on the day and to understand what a huge difference, what an impact you made in all those patients' lives that you treated that day to get them back to walking, to get them back to work, to get them back to their lives. I mean, that's, at the end of the day, that's what we do. And I think there's no place like it on earth to come and work here, to be a part of this place. It's very special.